Hello, welcome to another session on Girl Talk TV on RPTV. I'm your host, Sumaya Iman. Today we have with us Jacqueline Sharpe. She has a Master's of Science in Diabetes Education and Management from Columbia University and a Bachelor of Science in Nursing from Ryerson University. She is a registered nurse and a Certified Diabetes Educator at Regent Park Diabetes and Endocrinology. Jacqueline, welcome.
Thank you. Thanks for having me.
No problem. Can you tell us about yourself? Like, what is your role?
As a diabetes educator, I work with two endocrinologists, as you had mentioned. It's from Regent Park Diabetes and Endocrinology. And I do assessments of patients, assess their management of diabetes, which includes both working with their meals and also looking at their medication and also their lifestyle changes. Because I'm the only other person with those two doctors, there are no other allied else apart from myself. So I do basic assessment really of dietary needs.
What inspired you to pursue this career? Like, what gave you the idea, like, oh, I want to become this?
My family has a very strong history of diabetes. And so that was where it all started, from church back in Jamaica. In addition to that, we had some persons who weren't able to go to school, so they didn't have anybody to assist in terms of educating them and advocating for them. So I felt the desire to lead, and I felt the desire to lead persons with challenge with social determinants of health. And the main ones that drove me was mental health and education. In addition, and like I'd mentioned earlier on, I really feel that I'm an advocate for these people.
Did you consider any other paths other than nursing?
My first profession was teaching, so I'm a trained teacher, so I taught for several years. And then during the years, then there became a passion for persons with diabetes, and then I went back to school to do nursing. So that was my first profession, which was, of course, teaching.
Was it hard going back to school after you already had your education in another career path?
I wouldn't look at it like another career path, but it all came in place when I migrated to Canada almost 13 years ago. So when I came to Canada, I recognized that in terms of survival, I had to go where there was the need. And so for me, it was to go back into nursing, and then my passion rekindled in terms of working with those persons. And it was then that I decided to go on to Ryerson and pick up back my nursing again.
What is required to get into your fields, like school-wise and volunteering?
So one of the things that I look at in terms of anybody going towards volunteering or doing the diabetes educator, which I'm in, apart from the background in terms of your education for you to become a registered nurse, or even to do the certification in diabetes education, I would say the person has to first and foremost have a passion and a love for people of all kinds. In addition to that, have a non-judgmental attitude and a caring personality. And with all of these things, because remember, as you think about persons with diabetes education, it's from different walks of life, different educational background, different everything. So even if you have the knowledge and you don't have those passion to care and the love for people, then the way in which you take care of those persons would be detrimental to their health, because you're going to come across to be a judgmental person. And if you think about diabetes education, it's a chronic disease. So persons very often come to you with some idea as to how to manage. But because it's a chronic disease, what you find is that people very often have what we call diabetes distressed. I wouldn't use depression, I would say distress, because it's so long, it's a lot of work that is involved in making all of those changes. So the person who comes to help or to work alongside persons with diabetes has to have the desire to care, like I'd mentioned, and a passion to serve and to love people of all kinds.
Mm. Is there any school, like, if I were to start from high school and I knew what I wanted to go into the medical field, specifically in the diabetic realm, what would I have to do to like what other things would be helpful to become that?
Okay, so anybody can become a diabetes educator. It's always easier for the person who has things in the medical field, but we have had pharmacists, we have dietitians, anybody who wants to become a diabetes educator. So it depends on where your passion lies and that need. If it is, for example, in nursing, you would have to complete the bachelor's first and then do the RN exam. And then you do an extended or postgrad education that focuses on management of diabetes, because the aim is to help yourself to be at that point where you can get patients to be able to self-manage their diabetes, because that is the ultimate goal of all of this, to get patients to self-manage. And different persons respond and achieve or capabilities at different level. So as they reach those levels, then you can say, fine, I'm not going to be always in the forefront, but know that I am there to support you if the need arises. So you need to be able to, like I mentioned earlier on, it's not about just having the academics, because that is one aspect of it. But if you don't have the compassion and the caring and the non-judgmental attitude, and the whole idea of your role is service, then you find that you're not going to be able to assist persons who really need you, especially if they're at a point where they're very distressed, very demotivated, and just feel like, they want to give up, because this is a chronic disease. It's not going anywhere. It's always going to be with them.
What do you enjoy most about your job?
I like the fact that the patients allow me to be a part of their journey in terms of their diabetes. And I say allow me to be, because not everybody wants you to be that person, to be their care provider. And again, it goes back to what they sense when they're in relation with you, the therapeutic relationship. So for example, if a person patient comes to me and they feel uncomfortable, they may not want to come back. So the fact that they're willing to accept me to be a part of that journey, that feels very good. Another thing that I like about my job is that every day is a different day for me, because there's no one person or two persons that are alike. So it's always different. They always have different things going on. So it's a different thing every single day. So I like the difference, because it's a difference in a good way. And I'm learning and they're also learning. So it's not that it's a one-sided relationship. Both of us are benefiting from that relationship.
Are there any challenges to your job?
The few challenges that I find is to accept that not all my patients I'll be able to reach. And it's not a reflection of my efforts. So let me expand a little bit on the fact that I say not all my patients I will reach. So I may be trying to assist persons to make some changes. But one of the biggest challenges that you face sometimes is that people like to do things the way they're accustomed to doing things. People don't like changes. And so it's a big challenge to get people to see what they're actually doing right and to make those changes, even though those changes can mean for them a better quality of life. But it's very challenging. The other thing I find a challenge with is that sometimes, even though patients change, it may not be sufficient to have an impact on their overall health. And that sometimes it's a little bit hard to see, because you know that they're trying, but they may be so far gone in terms of complications that you know that the only thing you're actually trying to do is just to improve the quality of life, but you see that you're still trying, and it may not make much difference in terms of the whole overall picture of what is happening. The most devastating thing, however, is some of my patients will die. And that is the reality of it all. And they will die a lot of times because of complications from that disease. So that is the most challenging in part, because they have a complex disease, you eventually over time develop a relationship with them. And it is that relationship, because you're there, you're compassionate, you're caring, you're advocating for them. You've done just about everything that you can do. And yet you have to accept that some patient will still die. And it's challenging because it's like they're like your family member of the time, you know, because you're seeing them so often. And that part is very challenging to see them go.
Who would you recommend your career path to? Like, what qualities should a person have?
I think, like I said earlier on, caring attitude to serve without being judgmental, person who love to encourage other persons, and persons who are creative and want to make a difference to person's life. For me, it's not more so just being knowledgeable and educated about it, because anybody can get that knowledge and the education. But you have to recognize that the profession is one of service. And so with service, the qualities that comes with service is caring, compassionate, non-judgmental. And if you have those attitude and the love for people, then you'd be of tremendous use to the profession. And those are the persons that I would truly recommend. All of us don't have the same qualities, which is good because difference is good. But I think it's at this point when you recognize, like I said, these persons are have this disease for a long time because it's a chronic disease. So they must recognize that they're coming to serve persons. And that is what it takes for me in terms of giving service to these people.
Are there any advantages or limitations in your field?
The biggest advantage I find is that I'm making a difference to a person's life. And I think that is how I want to look at it. I'm at a position where I can make a big difference to the outcome of a person's life, depending on where along that path or that journey that I would meet them. And I like the fact that I'm able to make that difference. I like the fact that I'm also able to advocate for the persons who are less fortunate. There are different things out there that a lot of times persons are not aware that we have certain things available. Like, for example, you might have access to medication, other healthcare professionals, and just to advocate for better quality care for these persons. That makes my everything quite good for me in terms of the advantage of my job. The limitation is the inability to save everybody that I may come in contact with. That is one of the limitations. And like I said, it's very painful at times because you can't save everybody depending on where you've gotten them. And so it's difficult to see that they will eventually die. So that is the biggest limitation.
I would like to thank Jacqueline Sharpe for talking to us today at her work at Regent Park Diabetes and Endocrinology. I am Smay Iman, and thank you for watching another session of Girls Talk TV on RPTV.